Hello, I'm Ralph Nixon from NYU and the Nathan Klein Institute in New York, and I am co-organizing the Autophagy and Neurodegeneration Symposium in March 2023, and I have as co-organizers Anna Maria Cuervo and Gil DiPaolo. Well, it's been a thought I've had for a long time, and it's now coming to fruition. And the vision was to bring together the large community of neuroscientists that have interest in neurodegeneration and autophagy, and to develop the concept of a bed to or a bench to bedside format where we bring together both academics and industry to synergize in concepts of autophagy and how it may translate in neuro disease. So this is really the first such conference that's focused solely on neurodegeneration in autophagy. The other unique aspect of it is that in the neuroscience community, the people involved in disease research tend to be siloed in the conferences that they attend, and therefore an Alzheimer person may not come in contact with a Parkinson's or a motor neuron disease investigator, and they may be all looking at autophagy in some form because it's now involved in many different disorders, but they're not having the opportunity to synergize. And this meeting will bring together all of these disease interests and the entire neuroscience community over these issues and meld it with the industry that is growing now very rapidly, interested in autophagy as a target for neuro disease, and the ability to have this synergy is, I think, unique. The field of autophagy in the brain has been smoldering for a while, and now it's caught fire, and a lot more people are doing research at the fundamental level as well as at the translational level. And we now have a foundation of how complex the autophagy systems are in the brain because of the cellular heterogeneity, and some of the things that we now know are the different types of functions served by autophagy in different brain cells. And this is something that is not encountered in other meetings. The knowledge that we now have that in many diseases, autophagy is, if it's not a primary pathogenic dysfunction, it's certainly involved in a secondary important way. And there's now translational research, preclinical work that is showing very promising results, suggesting that we are very close to translating the knowledge, the basic knowledge, into a real clinical arena, and having the industry here to both show what their advances are up to now and what they're planning, I think will be very inspirational for all of us. One of the interests and one of the focuses is to address the challenges at this meeting and how they're being overcome to access the brain through imaging and the new techniques to actually visualize autophagy in vivo, either in mice and now even some PET ligands that may be useful in the future for clinical imaging. And this is going to propel the field forward to be able to validate drugs. More broadly, I think many people may not be aware of how autophagy is impacting the disease. And in most diseases these days, there is evidence that autophagy is playing significant roles. And so the entire neuroscience community who are interested in translational research as well as more detailed fundamental studies of autophagy should find it interesting. So it should capture a much broader audience than simply those that are interested in autophagy.